point. So the pharmacist in charge accepts responsibility for the pharmacy operations following the law and is in full and actual charge. They must be designated on the pharmacy permit. I repeat, they must be designated on the pharmacy permit. Usually they're just in charge of one pharmacy unless the board grants them an exemption. They must be present in the pharmacy for 10 hours a week, and a pharmacy can go without a PIC for up to 14 days. Responsibilities. The PIC is responsible for quality assurance, procurement, storage, safety, and security of all the drugs, disposition of drugs and services, making sure all pharmacists, interns, and techs are licensed, making and filing reports required by law, and notifying the board within 14 days of any change in PIC, pharmacist, or pharmacy hours. They're also responsible for responding to board identified violations. Now, for a drug manufacturer or medical gas company, PICs must do inspections quarterly, so 4 times a year. For a medical gas company, that inspection includes a review of permit records, sanitation, and security. And the PIC of a medical gas company can be a PIC of multiple facilities. For a manufacturing company, the inspection includes a review of permits and records and security and control. So the gas company, same thing, except they include sanitation as well. Again, PIC of manufacturing company can be a PIC of multiple facilities. Only in-state manufacturers need a license. All out-of-state or wholesale distributors. Manufacturing includes the packaging, repackaging, or labeling, relabeling of its container, as well as the normal definition of manufacturing. Any in-state business that does this needs a Kentucky permit. Pharmacists have a duty to report a few things. That includes the conviction of a felony, which must be reported within 30 days, any pharmacist incompetence, fraud or deceit in obtaining a license, or any info that a pharmacist, intern, or tech has stolen drugs, has a physical or mental disability, or violated a board order. Pharmacists can give professional opinion to a patient regarding the capability, effectiveness, and acceptability of any drug. Now, when it comes to patient records, a pharmacist or designee will get pertinent patient info which will be readily retrievable, must also be immediate, and show the previously dispensed drugs and known disease states. The pharmacist must perform a prospective DUR with newly dispensed drugs. Must include these in all of the records. So for all patient records, you have to have 1, patient full name, 2, address, 3, phone number, 4, age or date of birth, 5, gender, 6, a list of all prescriptions obtained in the previous 12 months, 7, known disease states, and 8, drug allergies. All records are confidential, but counseling is not confidential. Counseling can be performed by a pharmacist or an intern, either face-to-face or over the phone. To counsel, it includes 8 different requirements. You have to include the drug name, dosage form, strength, route of administration, proper storage, common and significant adverse effects, interactions, contraindications. For deliveries, you have an offer made by the delivery person and a signature is obtained. You can counsel over the phone. Counseling in hospitals is only required on discharge meds. You don't counsel on inpatient drugs. Documentation is only required if the patient refuses counseling. If there's no documentation, it's assumed they were counseled. Must keep a record of the refusal to counsel for 1 year. All refusals to counsel, keep a record 1 year. And the disease states that must be reported to the health department include tuberculosis, measles, cholera, E. coli, rabies, rubella, and diphtheria. Immunizations. For Kentucky, you can immunize anyone who is 9 years and older, and it must be given by a pharmacist or intern and must use a protocol, standing order, or prescription.